Asthma is a chronic respiratory condition that affects the airways in the lungs. It causes inflammation and narrowing of the airways, making it difficult to breathe. Common symptoms of asthma include shortness of breath, difficulty breathing, especially during physical activities. Wheezing, a whistling or squeaky sound when breathing. Coughing, often worse at night or early morning, sometimes leading to chest tightness or discomfort. Chest tightness, feeling of pressure or constriction in the chest. The pathophysiology of asthma involves complex interactions between genetic, environmental, and immunological factors that lead to chronic airway inflammation, hyperresponsiveness, increased sensitivity, and airflow obstruction. Here's a breakdown of the key components. Inflammation. Asthma is characterized by chronic inflammation of the airways. When exposed to triggers such as allergens, irritants, or infections, the immune system in susceptible individuals responds by activating immune cells like mast cells, eosinophils, and T lymphocytes. These cells release various inflammatory mediators like histamine, leukotrienes, prostaglandins, and cytokines. These substances cause swelling, increased mucus production, and the recruitment of more inflammatory cells to the airways, leading to airway narrowing and obstruction. Airway hyperresponsiveness. In asthma, the airways become overly sensitive or hyperresponsive to various stimuli. This hyperreactivity leads to exaggerated bronchoconstriction, narrowing of the airways, and increased difficulty in breathing when exposed to triggers that may not affect non-asthmatic individuals. Bronchoconstriction. Smooth muscle cells surrounding the airways contract excessively in response to the inflammatory mediators, leading to bronchoconstriction. This constriction further narrows the airways, making it difficult for air to pass through. Mucus production. The chronic inflammation in the airways triggers an increased production of mucus by goblet cells. Excessive mucus contributes to airway obstruction, making it harder to breathe. Remodeling of airways. Long-term asthma can lead to structural changes in the airways, known as airway remodeling. This includes thickening of the airway walls, increased smooth muscle mass, and alterations in the structure of the airway tissues. These changes can contribute to persistent airflow limitation even between asthma attacks. Genetic and environmental factors. While specific genes related to asthma susceptibility have been identified, the interaction between genetics and environmental factors plays a crucial role. Factors like exposure to allergens, respiratory infections during childhood, air pollution, tobacco smoke, and occupational exposures can increase the risk of developing asthma or exacerbating existing asthma symptoms. Understanding the underlying pathophysiology of asthma has led to the development of various medications targeting specific aspects of inflammation, bronchoconstriction, and airway hyperresponsiveness. Management strategies aim to control symptoms, reduce airway inflammation, prevent exacerbations, and improve overall lung function and quality of life for individuals with asthma.